Can you talk a little bit about chest care in the early days?
Okay.
So, what sort of things would you do, and what's the sort of aim of the traditional physiotherapy interventions at that stage?
Yeah. So obviously, when they come in, most of our head injury patients are, if they're operated on, or if they're in with a hypoxic brain injury, they are vented and sedated. With that comes all the risks of then developing a ventilator-acquired pneumonia or a hospital-acquired pneumonia. Very often the neurologically impaired patients require a surgical or a percutaneous tracheostomy, which then leads to problems with that gets them off the ventilation systems quicker, so that they can move on from the intensive care setting more quickly to a neuro HDU, where they can start to get the specialist team input more comprehensively. But then we're left with the issue of getting that tracheostomy out, if at all possible. They're a difficult patient group to treat from a nursing point of view, but they're managed very well. We treat their chests through a variety of traditional methods. We'll do suction, we mobilise them, we mobilise their upper limbs, we mobilise their chests. We'll assist them with a cough if they need a cough assist, and then we will encourage them to cough and clear themselves, or we will use suction for the patients to clear their chests. The best way to clear a chest is to get a patient sat up, get them moving around, keep their chest compliant. Their chest care is obviously paramount, because it means that if they're oxygenating well, then they're getting a better supply of oxygen to their brain and to the rest of their tissue. So their general health will be better if their chest is well managed. It means they can come off the oxygen more quickly. It means that we can, if they've still got their tracheostomy in, we can start to look at speaking valves, which improve sensation for swallowing, but equally, again, it all comes back round to we can start making those early assessments about communication and expressing, if they can express their wants and needs, which is paramount to patients and their families.